Our agenda for today's session, Target Seniors Falls event, is on the screen. Wendy and Ellen send their apologies for not being here today. Thank you to Chelsea and Michelle for stepping in. All contact information for all our speakers are on this screen and again at the end of our session. First, we will have Chelsea Taves and then our panel speakers that you see on the screen, exercise specialists and recreation therapists, will be up next. We will wait until all speakers are finished and then we will open up the floor to questions. At any time during the sessions, however, you can write your questions in the chat box. At the end of both sessions, you can also unmute yourself and ask your question verbally if that is your preference. So jumping right in, I would like to have our first speaker, Chelsea Taves, come forward to speak. Thank you.
Thank you very much, Jen. Hello, everyone. My name's Chelsea. I'm the geriatric nurse for the Wolf Creek Primary Care Network in Lacombe. And Wendy sends her regrets. She unfortunately couldn't present today, but she's the geriatric nurse in Innisfail. She designed the Healthy Aging program with a vision to improve the quality of care that we're delivering to our seniors in the community. And she's also a key member of the Community Partners in Action, which I'll speak more about in this presentation. I'll just share my screen here. Can everyone see that? Okay.
Yes.
Perfect. So Wendy is a very passionate person about this work. She has spurred this amazing grassroots initiative in Innisfail, which has been really successful and improved the quality of life for many seniors and their caregivers. I feel very fortunate to have trained under Wendy when I started as the geriatric nurse in Lacombe. Her passion for this work is truly contagious, and Wendy and the rest of the Community Partners in Action have been a tremendous support to our healthy aging and dementia-friendly work in Lacombe. So hopefully I can do this presentation justice. Wendy wanted me to ensure that everyone knew that they could email her or Ellen specifically. So I'll put their email addresses up in the chat box later. And I just want to say, Wendy gave me her speaking notes, so if I say something I shouldn't, it's not my fault. Okay. So the goal of the Community Partners in Action and the Healthy Aging program is to create age-friendly environments that align health systems and take a different, more collaborative approach to supporting older adults in the community. The Healthy Aging program in Innisfail depends on the Community Partners in Action, a partnership between the Wolf Creek PCN, the town of Innisfail, FCSS, Alberta Health Services, and others, to ensure that both health and social needs are met. Healthy aging can be defined as the process of developing and maintaining the functional ability that enables well-being throughout older age. So the Community Partners in Action identified many issues interfering with healthy aging of the seniors in their community, including an absent standard of practice for frailty identification and management, which I'll speak more about later, fragmentation of care, navigation difficulties, the rising number and complexity of older adults, polypharmacy, and care partner burnout. They decided to look at how they could coordinate a community-based senior serving sector that is integrated and can empower and support seniors to age how they choose, ultimately improving the health and social outcomes. Patients and their caregivers were included and active participants in this work. And there's a quote up there on the side that you can see from one of the care partners that says, well, they're working together. They're talking about his issues and my issues, and I feel that they are trying to help both of us manage our life as we can. From a medical perspective within the clinic, they decided to look at a frailty model of care. A frailty screening process was implemented to ensure a person-centered and individualized pathway of care and to identify individuals who are less frail and could benefit from preventative measures. And you can see at the bottom of the slide there in the corner that some of the programming that the community partners in action have put in place so far. So to speak more on frailty, sorry, I'm getting ahead of myself. So our current healthcare system focuses on disease-specific outcomes, which is appropriate for healthier individuals with single diseases, but not necessarily effective for those with multiple chronic conditions, who are often older adults who are vulnerable in living with frailty. Frailty, as you can see, is a multidimensional syndrome. It includes physical, cognitive, psychological, and social challenges, often coexisting within the individual. And it's important to know that frailty predicts risks for adverse outcomes, including falls, hospitalization, ER visits, and death. Individuals who are living with a higher degree of frailty are more likely to have these adverse outcomes. So why does it matter? Well, frailty is costly as it leads to many ER visits and hospital admissions. Prevalence of frailty increases with age and is higher in women. 10% of people age 65 and over, and 25 to 50% of people age 85 and over are living with frailty. It's a dynamic process that can occur over a span of 5 to 10 years, with episodic deterioration occurring with minor stresses, meaning that frail individuals are not as resilient and do not bounce back from even small insults to health. But becoming frail is not an inevitable part of aging, and it can be reversed or attenuated by interventions. So it's important that we rethink frailty as a chronic condition. This is what we know and what the future could look like. The language around frailty needs to change to ensure that we're not defining individuals by their frailty status. We need to transition from using the term the frail elderly to an older person living with frailty because they're still a unique individual. We need to transition from providing reactionary care to individuals who are presenting late and already in crisis to identifying frailty early and providing preventative and proactive care. And a preventative approach to care, of course, is best served in the community rather than the hospital setting. So this infographic comes from the World Health Organization, and it outlines the global vision for healthy aging, which the community partners in action have aligned their work with. As Wendy would say, we're not making this shit up. So every older person is different, and what is needed for healthy aging includes a change in the way we think about aging and older people, which includes marginalized older adults, such as people living with dementia. We need creation of age-friendly environments. We need alignment of healthcare systems to the needs of older people, collaborative and integrated rather than organizations working in silos. We need the development of systems for community care and long-term care. The pandemic has certainly highlighted the challenges of the long-term care system. And people, for the most part, prefer to stay living in their own home. So only 3% of seniors actually live in long-term care and 90% in their own home. So with this in mind, maybe it's possible that we should refocus our efforts and resources to community care. Many of the individuals who are served by the Community Partners in Action and Healthy Aging Program have a history of falls and dementia. So I wanted to touch briefly on the link between dementia and falls. People with dementia tend to be at high risk of falling, and they are at least 3 times more likely to fracture their hip when they fall. Falls have the dubious honor of being the top cause of injury and injury-related death in people older than 65. And a fall can result in a major decline in independence. A person who has a hip fracture may no longer be able to live independently in the community and might have to move to residential care. So the reason why people living with dementia are more likely to fall include problems with their mobility, balance, and strength. They're prone to pacing. They have trouble finding their way around and paying attention to hazards. They may have changes to their insight and judgment, causing them to take more risks. As well, they often are taking medications that might make them drowsy and lower their blood pressure or cause problems with coordination. So strategies to decrease falls among those living with dementia include reviewing their medications and discontinuing where possible those that are associated with falling, and ensuring a safe environment and optimizing physical fitness and strength through promoting activity and exercise. However, this can be easier said than done. Many exercise interventions provided by the community services are not designed or tailored for people living with dementia. So the community partners in action decided to work together to create a fall prevention program specifically for individuals with dementia to fill this need in their community. So although dementia cannot be reversed, evidence suggests that the resulting decline in function can be delayed. On this slide, you can see some information about the fall prevention program that they created called Step Up to Stop Falls for people living with dementia. And it lists a lot of the benefits that the individuals living with dementia and their care partners received through this program. Physical exercise, meaning planned, structured, repetitive, and purposeful physical activity, constitutes a promising intervention for individuals living with dementia. In fact, physical exercise has been described as a non-pharmacological alternative to treatment of dementia and benefits the individual through modulation of the brain structure and function through increased neurogenesis and neuroplasticity. Exercise interventions have been found to reduce several cardiovascular risk factors, reduce the risk of falls, improve metabolism, strength, and functional capacity. So ultimately, regular exercise reduces the risk of developing dementia or delays the onset and improves the quality of life for those already living with dementia. So as I start to wrap this part of the presentation up, I want to emphasize that to be able to support healthy aging, we need to bridge the health and social system gap. This slide shows the different organizations and individuals involved in the community partners in action work. And it's important to note that levels of trust between citizens and groups in society is declining. We live in a complicated time. It is a divisive, polarizing, and we tend to seek like-mindedness. We live in a time of growing alienation and isolation, and we're losing trust in our institutions and governments to act in our best interest. And we have growing economic and ideological divisions and tend to compete with one another rather than come together over shared values and goals. And I'm saying all of this because it's not always easy to do this collaborative work, as our towns and cities are trying to solve increasingly complex issues. However, on the flip side, these complex issues are better tackled when we start to collaborate across sectors with people who we have not collaborated with before. And it's very important that the individuals around the collaborative table have trust in one another. So some of the successes that the community partners in action and the Healthy Aging program have seen include person-centered care, integrated community-based health and social services, collaboration between the medical home, Alberta Health Services, the town, FCSS, and others, collaboration in program development, grant applications, and creative thinking. Some of the challenges that they have encountered include engagement of community partners, lack of time and off the side of the desk activities, lack of resources, culture change, both professional and public, and wondering who to include and who the stakeholders should be. Of course, the pandemic was a challenge, and organizational priorities and evaluation proved to be a challenge as well. But lessons were learned, and some of those were that it's important to include the individuals that they are serving in planning and evaluation. Action planning is imperative. You want to ask yourselves, what will this look like? And keep asking yourselves that throughout the planning. You want to develop standardized processes and evaluation because that aids in the sustainability. And you want to think about who will continue this work once we're gone. For evaluation, they found that gathering people's stories was more impactful than numbers, and regularly scheduled meetings were imperative to success, along with sharing with community partners and stakeholders. If something comes across my desk, I share it. We must be open, inclusive, and trusting of one another to be successful. This slide shows the health ecosystem created in Innisfail through collaboration and person-centered care. So I'll just actually put some links as well as Wendy's and Ellen's email up in the chat box. Bring that up. Oh, I'll just do that after, once I'm done sharing. So just to go over this, the World Health Organization provides a guiding vision for healthy aging. I'll put a link up for that report. And the province of Alberta has outlined the dementia strategy and action plan, so there'll be a link for that too. Just a note to Alberta Health Services and the Primary Healthcare Integrated Geriatrics Services Initiative, who've been a great support for this work, as well as the work that we've been doing in Lacombe. So there will be a link for their webpage there as well. The town of Innisfail is age-friendly community, so that's been really beneficial to the work being done in Innisfail. They have the FCSS, which offers preventative programs that assist with social connection and group support, and that offers the opportunity for stakeholders to collaborate. The PCN includes the family physicians and the multidisciplinary team and houses the Healthy Aging program. And there will be a link there for the PCN webpage and the Seniors Information Hub. And then, of course, the Community Partners in Action. They're the collaborative partnership of multiple organizations who seek out and implement grassroots solutions to integrate a community-based health and social services, including Alberta Health Services, Wolf Creek PCN, FCSS, the town of Innisfail, the people living with dementia, and their care partners. And that is the world's oldest human. So nice to include that. So, and those are some of the references. So that is all I had.
Okay, thank you, Chelsea. That was a great session, and we're so thankful you were able to join us today and help out Wendy, who couldn't be here. Thank you again. Again, we will save all questions till the end. So Chelsea, if you can hang on till the next presentation. However, if anyone has questions they want to put in the chat, you can do that now, but we will save the questions until the very end. I would now like to have our speakers for this second session come forward to present.
Hi, thanks, Jen. And I want to thank Cindy too for the technical support and all the help that you guys are doing behind the scenes today. My name's Michelle Sharp, and I'm the professional practice lead for recreation therapy in Central Zone. And I am filling in for Ellen today. Unfortunately, she wasn't able to make it to this session, but like Chelsea said, I have all of her talking notes. So And Wendy and Ellen's contact information will be on the final screen, and they'll be putting their emails in the chat box. And if you have any questions specifically for them, feel free to email them. So falls prevention programs are not a new concept. What makes this program unique is that the program has been adapted to support people living with dementia. And it provides 2 hours of respite for care partners each week, and the sessions include 30 minutes of guided, consistent exercises, then 30 minutes of activities to stimulate the brain. The sessions give the participants time to connect with each other in a safe location, free from judgment. And of course, there's always time to reminisce, share stories, and have a few laughs together. Each participant is referred to the program by Wendy, the WCPCN geriatric nurse, and we have been able to track the participants' balance, strength, and cognition through short assessments that are conducted every 3 to 4 months. The graph here is what we would expect for participants to be able to maintain their abilities and at the same time showing some improvements. We have also facilitated a partnership with Alzheimer's Society of Alberta and the NWT to offer their monthly care partner support group at the same time as the Falls program. This gives care partners a feeling of freedom to be able to attend while the persons living with dementia participates in the Falls prevention program. Ellen, is consistently amazed at how the participants support, protect, and encourage each other. She's noticed that since starting the program in June of 2019, and now the change in the participants as they're becoming more confident and connecting with each other in the community. The program has carried on since March 2020 online due to COVID. With COVID pandemic came the opportunity for community partners in action, which includes Alberta Health Services, Wolf Creek Primary Care Network, Innisfail FCSS, and the town of Innisfail to really think outside of the box to support people during the pandemic and beyond. Let's Connect was born on May 20th, May 2020. In order to build upon this opportunity to ease potential social isolation, it was important to partner with other groups and organizations to bring the programs to life. Let's Connect provides a variety of interactive online or phone social and health program opportunities for people in Alberta, both rural communities and urban settings. These programs are free of charge and provides friendly conversation for older adults. They offer a variety of programs that focus on physical and cognitive health, social opportunities, tech support, music, and education. We know that there is always be individuals in our communities that are unable or uninterested to attending programs face-to-face, so Let's Connect can still support individuals in this type of situation. Ellen is talking about Let's Connect as some of the programs that are hosted are to keep people active and prevent falls, such as Movers and Groovers and Healthy Moves. The Healthy Moves is a fall prevention exercise program that runs 2 times per week and is led by the recreation therapy assistant. Healthy Moves is available to anyone who would like to participate with others online. The Community Partners in Action team were successful in receiving the Horizons grant worth $25,000. The majority of these funds went to purchasing 65-inch smart TVs and iPads to be placed in community seniors' apartments, the condos, and local churches, seniors drop-in, and the library learning center to enable people to be able to attend Let's Connect or other online programs from their own homes. There are 9 systems put in place in the community, which has given these locations and people the opportunity to remain engaged and active in their community. So that is some of the information that Ellen has put forward about the programming that is happening in Innisfail. And I'm going to advance the slide, and Brad, I'm going to let you continue.
Thanks, Michelle. Hi, everyone. My name is Brad. I'm an exercise specialist with the Wolf Creek PCN in Innisfail. What I want to do is just go through the programs that I offer currently. I'll explain how they're run, what they're about, and then some of the reasons why I think they're successful. So currently I do 4 programs. The first one being Movers and Groovers. So this is a follow-along exercise program done in the community. So it's I partnered with the town of Innisfail. They offer a space. It's a wide open, really big conference room, basically, with a bunch of chairs and a speaker system provided. So this one runs Monday, Wednesdays, Fridays, so 3 times a week for 1 hour, and it runs year round. So it used to run for 8 months out of the year with a 4-month break. And then it was so successful, we decided, why even take the break? Let's just run it year round. So what it is a resistance training program. So focus on muscular fitness, developing strength, power, endurance, as well as incorporating stretching and balance training. So as you can tell, it's not advertised as a fall prevention program because that can kind of limit it. Exercise is beneficial for many things, not just falls. But the benefits you do get are very good for preventing falls. So what it is, I lead the class each day for the 1 hour. So it's led by a fitness professional. And what people do is they come and they just follow along for the hour. So we typically start with a little warm up, then we do some balance training, and then strength training and stretches for the rest of the time. Now this program, when I started, we started with 5 people. And right before the pandemic, we had a class that had 100 people. So it grew significantly since I had started it until the pandemic. And then we had to go online, of course. So we started using Zoom, and attendance dropped quite a lot when we went online. But we've been in person for a little bit again now. And what we've done now is combine it. So we do in person and online. So the Community Partners in Action provided us with an iPad, and I simply set Zoom up on the iPad and stream that for people that prefer doing the exercise from home. But anyone that wants to do it in person can come back and do it in person now. So what are some of the things that made it successful? Like, why did attendance drop off when we went online? So there's a few things. The social aspect of an exercise program is really important, especially seniors or older people really like to get out and socialize. Maybe some of them are a bit more isolated, but it's a huge draw for people to actually get out of the house, see and interact with other people from the town in the community, and then of course to do the exercise. So that's a huge part of it. We also try to make it fairly fun. So we play music throughout the whole class, mostly music from the 50s or 60s, like the Beatles or Elvis, things like that. And then, not taking it too seriously. So we like to joke around and have fun with it as well. But the whole time, because it's being led by a fitness professional, the exercise is, backed by science, it's evidence-based. Doing what is recommended for seniors or people with this level of conditioning. So that is one of my main programs. Like I said, one of the more successful ones. But if we could go to the next slide, I'll show you another one that's quite different. So I do another program in the Penhold Multiplex Fitness Center. So this one is inside a gym, whereas Movers and Groovers was just in the town in an open space. And this one is different because it's more individualized. So I run this 2 times a week on Tuesday, Thursdays, between a 3-hour period, 9 to 12. And with this one, what people do is they come to the gym. We've met before, talking about health history, what their goals are, things like that. And I've come up with an individualized exercise program. So where Movers and Groovers is very general, everyone is doing the same thing. The supervised exercise program, everyone is doing a different program that is specific to where they're at, to their wants and their needs. And when they come to the gym, some people have exercised in a fitness center before, some haven't. It's very hands-on. I take them through the program, make sure they're doing everything properly and safely. And then as they get comfortable, they become more confident exercising on their own. They become more independent. And then they just keep coming at the same time and doing their program. But I just supervise after a certain point. So it's much more hands-off. And then they can either keep coming at the same time as long as they want, or what they can do is take their program and come to the gym at other times. So this one is very good because it can focus on whatever they need, whether that's strength, balance, cardiovascular fitness, whatever. It can be individualized to them. So this is for people who prefer working a bit more independently, but it can be very, very beneficial because it is very specific to them. Okay, let's move on so I don't run out of time here. So those two programs are strength-based mostly, but I also do 2 walking programs. So if we can show the next slide. So walking doesn't actually have a lot of evidence to improve, to prevent falls. So if you have someone and you just have them walk, there's not a lot of evidence to say that that will help them prevent falls. But it can be very good for other things like muscular conditioning, cardiovascular health, and whatnot. So it can be part of a fall prevention plan, but you shouldn't do just walking if you want to help prevent falls. They need resistance training, balance training, and other things with it. So this walking program here can be part of an overall program. It's simply an outdoor walking program, very social. People just come together, we walk outside for about an hour. Not much to other than that, really. Like I said, it'd be part of a bigger fall prevention plan. But my other walking program on the next slide is a little more specific, maybe to falls prevention. So this one's called Steady Steps. What it is, it's in the same room as Movers and Groovers, so a big open space with a flat floor. And it's for people that struggle walking. So people who use a cane or a walker, people who walk very slowly, or people who have poor conditioning and can only walk for a short amount of time before needing a break for whatever reason, whether it's conditioning or pain or discomfort. So what we do is we have them come and we use interval training. So if you don't know what that is just alternating periods of work and rest. So people can come, they can walk for however long they're comfortable with. So let's say that's 3 minutes. They come walk for 3 minutes, then they take a break. And then when they're pain or discomfort or they've caught their breath, whatever the reason is, when they're ready, they walk again. So you build up conditioning through interval training, trying to walk as much as you can, but alternating work and rest. So like I said, walking alone doesn't really prevent falls as well as a program that combines resistance training. But for these people who have very low conditioning, it can be a good way to build up conditioning and fitness in the lower body, in particular in the legs, cardiovascular fitness, and whatnot. Another thing about this program is we have walking poles. So as you can see in the picture, walking poles like that lady is using, these can really help people walk for longer and be more stable when they walk than when using a cane or a walker. So with a cane, you've got it on one side. Typically, if it's not set up properly, especially, you can be lopsided, which can create some imbalances in your body. Or if you're using a walker, for example, you can be hunched forward or leaning forward. So what we do is we have people use walking poles. It keeps them nice and upright, so really good posture. It improves their balance and stability as they walk. So when you use the pole, it increases your base of support, which helps with balance as you walk. And it puts some of the weight into your arms, so you can use your upper body a bit, which can also take away some of the impact on the lower body. And the effect of this is that you can walk for longer, which can help increase fitness. You might not need to take breaks as much. and you're safer when you're doing it. So this one is really good for people that are quite deconditioned or just aren't able to walk a lot. But again, if you combine it with something like a resistance training program, you get the best effect in terms of preventing falls. So that one is twice a week, Mondays and Fridays for an hour. But again, you don't walk for the whole hour. It's just you start with whatever level you're at and then progress from there. So those are the 4 programs I currently run. As you saw, none are advertised as fall prevention programs, but they can all play a role in preventing falls. So thank you very much.
All right. Hi, everyone. My name is Alex. I'm a recreation therapist with the Lacombe Community Health Center, and I'm with Christy. I'll let her introduce herself quickly.
Hi, I'm Christy, and I'm the exercise specialist with Wolf Creek Primary Care Network in Lacombe and Ponoka.
So Christy and I run a fall prevention program. It is offered virtually via Zoom once per week over a 6-week span. And many of our resources are from the Finding Balance Alberta. We use the Fall Prevention Toolkit, PowerPoint slides, and we also create resource packages that are from Finding Balance Alberta for our participants. So included in our program, we offer pre and post outcome measures. So this allows the participants to choose if they would like to track their progress before they engage in the program and then after. So the outcome measures we use is the 30-second sit to stand test. We do the 4-stage balance test. And then we also do the Am I at Risk for a Fall survey. So our resource package for participants include an exercise diagram poster for them to do at home, how to maintain a balanced lifestyle, fall prevention in the home guide, resistance bands exercise booklet, and a poster on how to get up from a fall. So all of these resources are from Finding Balance Alberta, and they are offered for free. Our program is divided into two sections. So it includes a 20-minute education session followed by a 30-minute exercise program. Our education sessions include topics such as making the most of our vision, managing medications and blood pressure, how to maintain proper foot care to prevent falls, maintaining a proper diet, adaptations to our home, and what are some available community resources. So I will let Christy talk about the 30-minute exercise program.
Thanks, Alex. So the exercise program for this class is based on the Otago exercise program from the Otago University from New Zealand. And there's a focus on muscle strengthening and balance retraining using low impact exercises with minimal equipment needed. We only ask participants to bring a sturdy chair or like their dining room chair from home. So every week the program consists of 5 warm-up exercises, 6 lower body strength exercises for the quads, hamstrings, hips, and calves, static balances, and then dynamic balance exercises. So depending on individual strength and mobility, the exercises can be progressed throughout the 6 weeks by increasing the number of repetitions, increasing sets, or utilizing ankle weights for the strength exercises. And then the balance exercises can progress from supported, holding onto the chair, to unsupported, maybe just utilizing 1 or 2 fingers on the chair or hovering the hand over the chair to challenge themselves. So the Otago University found that when older adults completed the prescribed strength exercises 3 days per week, plus walking, they fell 35% less than others. So we do encourage our participants to practice these strength exercises or the exercises on the poster in their research package at least twice per week on their own, and then to also walk at least 90 minutes per week. So the exercises improve muscle strength, flexibility, balance, and reaction time, all of which contribute to reducing the risk of falls. So our target audience for this program is seniors, those who have fallen in the past or those at risk for a fall. And as Chelsea mentioned earlier, people living with dementia are likely to also be at risk for a fall. So we do encourage those living with dementia to register for the class. And we've had quite a few participants with dementia attend the program, be successful in connecting with their community, learning about preventing falls, and experience success with the physical activity portion of the class. And then I think Alex had just a couple last things to touch on for the
Yeah,
class.
thanks, Christy. We do understand that our program is virtual and that not everyone has the means to an electronic device. However, we are very fortunate that our local library has a senior loaner program that provides those individuals with an iPad that is already set up for them to borrow. And they have been great partners in helping those people who want to attend our fall prevention program use those for the 6 weeks. We are also currently partnering with rural senior centers such as Rimbey, Pinoka, and Bentley to provide this program virtually. So what they would do is they would provide a space for those living in that community to come together and exercise in person while joining on virtually. And to date, Christy and I are very proud of the successes everyone has made. We ran 4 sessions so far with 56 participants, and we are constantly growing. And that's all we have for our fall prevention program in Lacombe.
Okay, hi everyone. So I am Kim and I'm here with Lisa, and we job share the community recreation therapy position in Drumheller, Hannah, and Three Hills. Patrick is the exercise specialist for the Big Country Primary Care Network in those 3 communities as well, but he wasn't able to join us today. So we wanted to talk about a few things. The first one is the Community Falls Prevention Programs. So I think you can click Michelle for that to come up. Yep, there we go. So the way we did it was Patrick facilitated the program in each of the 3 communities. Lisa and I found the spaces, we got the word out, and we got participants referred or suggested to the program. We did that by reaching out to home care and outpatient physio and OT in those communities, as well as advertising through community organizations like their senior centers, manors, lodge, long-term care, caregivers, and that kind of thing. We were able to secure a space in all 3 communities with no cost. So in Hannah, we used their Centennial Place, that's their local gym and walking track facility. Similar in Drumheller, we used the Badlands Community Facility. And in Three Hills, we were able to partner with the Bethel Evangelical Church. They have a large carpeted gym that's open for all community members to use. So Patrick provided the participants with the band exercise for older adults using resistance to build strength and prevent falls. And that's a booklet that he sent home with them, as well as the TheraBands. Each session ran for 10 weeks. So they were 1-hour sessions. Monday it ran in Three Hills, Wednesday in Drumheller, and Friday in Hannah. Ideally, Patrick would have liked to do pre and post assessments, but the time frame didn't really allow for it, and we needed to get started so we could be finished before Christmas. All programs had varied start dates, but they ran from October to December 2021. Our goal, Lisa and I, was to attend at least one of the sessions in all 3 communities. And then in Three Hills, we were able to be there for their last session, which was great. We were able to get some participant feedback. So Patrick's comment about the Three Hills group was that they were really committed. They did really well. At the start of the program, they could only do 1 set of each of the 3 exercise circuits. But by the end, they were doing 3 sets of each of the 3 circuits. So the volume of exercise really increased for all those participants. Some of the client feedback was that they noticed a big difference each week between how they walk before they start the exercises and how they walk after. Balance is much better, and they felt stronger. Another comment was that the program was a lifesaver. When outpatient physio shut down, this was all we had. I don't know what we would have done to keep moving without it. And then another one was, we love to come. The sessions are great. It makes us work, but it also shows us what we can still do.
Yeah, so in meeting with local businesses and partnering with the different communities, we, for finding locations for falls prevention classes, we came to the realization that there are some wonderful spaces that need to be used. And in Hannah's case, they were free. So we, Kim and I figured, how can we get our local seniors involved? And that is how the Walk and Talk program came about. So first of all, in Hannah, we started our Walk and Talk program at the Centennial Place in Hannah. It was we wanted to do a 4-week program, started February. And Centennial Place has a free walking track. And so we asked if we could utilize the music room in that facility as well. So we started Tuesday mornings, 10 to 12. We would walk the track for 30 to 45 minutes. And then we would go to the music room after, and we would supply coffee and water and meet with the group afterwards. So initially, when the program started, we had 3 seniors, that 3 ladies that would continuously show up. And then by the end of the I guess 8th week that we facilitated it, there was 12 participants. So initially, Kim and I thought, well, we'll go in for 4 weeks, and then we'll kind of wean our way out and see if the program will continue on with us with that. So the ladies who joined us were very eager to continue on. So we facilitated it for another 4 weeks in March. And then after that, they wanted to continue as well. So the program continued on April and May. So we provided the coffee and we provided the water, and the town and the Centennial Place provided the space. And so the ladies would continue. We had seniors ranging from 60 to 85 from all different areas of Hannah, and they some of their feedback was they enjoyed coming together with local people that they maybe didn't know, and they got to meet each week, and they kind of kept an eye on each other and encouraged them to attend the program there. So the Walk and Talk program in Drumheller. So we wanted to, there was already Monday, Wednesday, Friday, the Drumheller Badlands Community Facility, the local gym, was already offering a seniors toonie walk. And so we thought, how can we build on this existing program and encourage seniors to come out and about and walk, as well as have the social component. So we partnered with the BCF, and they allowed us to use their small multi-purpose room for the coffee component at the end. And so Kim and I would show up on Wednesday mornings at 10 o'clock. We would walk for 30 to 60 minutes with the participants, and then we would head down for coffee afterwards. So, and the numbers for that program continued to grow. So the BCF would keep track of the people that came regularly. So as the stats that they presented to us, that they had 20 participants in February, and in March, there was 52 participants. So an average of 10 people per day, prior to an average of 7 that were prior to the program. So for the Walk and Talk programs, Kim and I, we would advertise via the town, social media, other local businesses. So as much as we could get the PCN, Alberta Health Services, as much as we could get the word out there to get as many local seniors out and about as possible. This program also allowed for encouragement to build social connections, increase physical endurance, and also keep the participants coming back weekly. So one other thing that we did to try to get the word out, I guess, was we did some finding balance presentations. So we used the everyday exercises for older adults to do at home sheet out of the Finding Balance booklet. And so they were the 6 exercises that are fairly simple to work into everyone's everyday life. So we would go to community groups, and we would present these exercises, do it with them, and then provide them with the sheet and tips on how to continue to do those at home. So we did them with seniors that were living in the manors in Drumheller and Hannah.
twice in each community. We also presented to a Crown Jewels ladies group in Hannah and the Tops group in Drumheller. And so they found that really helpful to run through the exercises and to see that it was things that they could do at home. It didn't take a lot of time. It was only 6 exercises and they could do it while they were watching TV in the evening or while they were talking on the phone or that kind of thing. We encourage them to just work it into their everyday life. And then we also used information in the booklets to provide facts about winter walking, medication reviews, and healthy eating habits.
So in connecting with some of our local seniors, we found that some of them were interested in having one-to-one exercises in their home. So if they reached out to us, we would go into their home and we would take our booklets and our information from Patrick, and we would review 6 finding balance strength exercises, or we would use the band exercise booklets in their home. We would go through the exercises with them, and we wanted to make sure that they would feel comfortable and confident to continue on independently. So also as we build clientele and community and get to partner with seniors in the community, we kind of put it out there that Kim and I are available. So if anybody felt comfortable or needed, that step up to go and locate the local facilities and use the walking track. So we would pair with them. We would go, I know once Kim paired with the senior, went and showed them the ropes at the local gym and how to use the walking track and what they needed, and just that a little extra hand.
And so lastly, what's next? So we are working with Patrick again to implement another 10-week falls prevention program in Three Hills. So we're just working on getting enough referrals to him, and he is doing the pre-assessments with this round. So we're hoping to have some good numbers to provide people when they're finished. Lisa right now is implementing a free 4-week aquatic exercise therapy program for seniors in Hannah. And then our plan in the fall is to assist the Badlands Community Facility with a chair yoga program. And then our walk and talk sessions were so successful, and you've heard already that there's not a lot of evidence that concretely links walking with falls prevention. However, if that's the only form of exercise that they're willing to do, then that's we got to meet seniors where they're at. So we are hoping to get those sessions going again in the fall in all of the communities when the weather is turning too cold to walk outside. That's all we have.
Great, thank you. Jen, do you have any wrap up, or should we just open it up for questions?
I have a little bit of wrap up, Michelle, if that's okay.
Okay.
Thank you to all our panelists. I really appreciate hearing from all of you, and as well, I'm sure everybody on the call does as well. So thank you again. So just before we go to questions and any further discussion, there are a few closing remarks. First of all, you will be receiving a short post-event survey. I do encourage you to complete the survey and return it to us. This will help us know how today's session went, and also will help us plan further events that are meaningful to all of you. So we thank you in advance for checking out that survey. We also invite everyone who isn't part of the core falls prevention group yet to continue these important conversations together. You can join CORE for free if you're not already on it, and find many resources, events, and programs all around Alberta. So to specifically join the falls prevention group, you just need to click on the groups at the top of the CORE Alberta website and then click join. And I see that Cindy, our tech support, has put in the CORE Alberta link there, and that will take you right to where you need to join. So you can take a look at that. And if you have any questions or comments about CORE, in particular for this group, you can check out our lead person for the CORE's Falls Prevention group, and her name is Shelley Dellis Smith. And I'm hoping, Cindy, you don't mind putting her email address in the chat. So Shelley can help you with the core falls prevention group. And then also if you have any general questions for core, you can also email healthyaging@calgaryunitedway.org. And I'm hoping that can be put in as well. Oh, I see our tech support, Cindy, has done that. So she's put the survey in the chat box, as well as signing up for core, the core website, and also Shelley's address, who runs the core fall prevention group. And then any general questions on core can go to that healthyaging@calgaryunitedway.org email address. Also, I want to let you know that all of today's resources will be added to the core falls prevention group section. So keep an eye out for these updates. I see we do have a little bit of time for questions, but what I want to do before I go to questions is just also point out in the chat, if you haven't had a chance to check, Chelsea Taves has entered a few resources as well. So the Wolf Creek PCN website is on there, as well as the United Nations Healthy Aging information, as well as some Alberta Health Services resources and a YouTube video that focuses on Innisfail, and also the Alberta Health Dementia Strategy link is also there. So thank you, Chelsea, for adding those already. Now, I invite you all, as we do open up for questions, to type anything you have in the chat and we will go right to them. But maybe while people are thinking about questions, I just had a general question I wanted to ask. And I don't have it targeted to anyone in particular, but for anyone who's running virtual programs, I know, for example, Lacombe or Innisfail or anybody else, I'm wondering, do you open up your virtual classes beyond your local community? So I will just mute for a second and see if anyone has an answer to that, because I think we have people from across Alberta that might want to know that as well.
Yeah, I can answer that from Christy and I. Yes, we do have people that join from all over. Like we've had a couple in Red Deer and some in Edmonton as well. We will never say no to someone who has the means or wants to join virtually.
And I just wanted to add to that some of the programs are closed programs that need to have a assessment. So some of the ones that Ellen is running through the Innisfail Let's Connect are closed programs. So they do need to have an assessment to make sure that they're appropriate to be able to participate in an online session so that there is no risk to the participant. Some programs are open to general public, but if you go on the Let's Connect website, you will be able to see which ones are closed and which ones you need to contact for further information.
That's great. Thanks, Michelle. Do we have the Innisfail Connects link in the chat, or is that just part of the Wolf Creek website?
It is on the Wolf Creek website, but
Okay.
maybe if you could look it up and then put it in the chat, that would be good. Jen, I think you're muted.
Thank you. I see Cindy, our tech, has just typed in, if you would like to ask a question or share your thoughts, just click on raise your hand button or leave comments in the chat. So thanks for that reminder, Cindy. I see Marita has asked a question, and it looks like she's opened it to everyone. How are these programs funded? We'll start with that question, and I'll open it to whoever wants to answer that.
Well, I can answer for Lacombe. We're actually very fortunate with virtual. The cost is very minimal, and the resources from Finding Balance Alberta are all free. So we did receive the New Horizon grant as well to purchase some equipment like ankle weights if needed. But other than that, it's in-kind contributions, because Christy and I ran this program 3 times without any funding.
Thank you. Anybody else?
Same same for me in Innisfail. So we're encouraged a lot to partner for programs. A lot of our programs have to be free, for example. So partnering with other community resources like the town, for example, FCSS, a fitness center, getting partnerships there. And then for the most part, there's no cost at all when you get those partnerships established.
Thanks, Brad. Anybody else want to add to the discussion? Okay, there is another question from Indy. Are these programs available in Edmonton? We have some clients who could benefit. I will leave that open to the whole group again to answer.
So because the Let's Connect is virtual and anybody can join via link, but for the Edmonton area, I just also wanted to point out that Senior Center Without Walls is also a program that is run virtually, and they have a number of different programs, and as well as you know, balance programs, fitness programs, cognitive and social programs, and it can be found. Cindy or Jen, if you want, I can't Google it on my screen, but it's the Senior Center Without Walls, and you can put the link in the chat box for that as well, especially for virtual. It doesn't matter where you are in the province. You can look at any of the links or programs. There's a number of lots of programs put on by a number of different services and facilities and things that you can connect no matter where you are in the province. And I was just going to point out too, with the Let's Connect, when it first happened, we have a number of people who do live in Innisfail when they first started, and loved ones from different across Canada were able to join in the education sessions or support groups or music sessions, so that then they could participate with their loved one who was living at home. Then they could have something to talk about. They could join together in any of the sessions. So not only is it provincial, but it's international, basically. I know that there was people who were away visiting in like snowbirds that wanted to join in with their loved ones, or across the Philippines, across all different continents, be able to tune in. And that's the nice thing about what happened with COVID, is that we are more connected now, be able to link virtually.
Yes, I agree. Thanks, Michelle. And I do see Cindy, our tech support, has put in the website for the Senior Center Without Walls website. So thank you, Cindy. Marita, I see you put something else in here. Who funds you? I don't know if you had your question answered. So if you just want to chat, or you can unmute if you liked. Let us know if your question was answered. Okay, and I see there's another question here while Marita's thinking about that, or has anything to add. Cherith asked, are these all coordinated through PCNs? So I'm thinking the programs that were mentioned today. I'll leave that open for the group as well to answer.
I don't know if somebody else wants to take over, but I was just going to maybe get Kimberly. That was a Kim and Lisa together. Kim and Lisa, or Alex and Christy, if you guys want to talk a little bit about that. I'll just mention that we have community recreation therapy positions that are in an uplift pilot, and a lot of these programs and initiatives are run collaboratively through the partnerships that have been developed in each of the communities to look at the needs of what the residents of the communities or citizens of the communities would need, and really looking at how the collaborative partnerships can provide programs that meet the needs of the people in the community. So Kim or Alex and Lisa, do you want to just talk about the partnerships and some of the other different programs that maybe you're running, that it's a collaborative partnership and different organizations and partners are running different programs depending?
Yeah, like I can talk a bit about it. Like for the fall prevention program, I felt like it made the most sense to have an exercise specialist with that expertise help run it. And when I approached Christy about it, we knew it was an ongoing problem in Lacombe, and she was on board, and that's how we created that partnership. But for example, like we have a Music for Dementia program, and that is partnered with the Lacombe Performing Arts Center. So it's many different organizations within that community that can help step up. They're not involved in every program per se, but if they're willing to like help out their community and provide that service, that's a discussion to be had. Our Lacombe FCSS is also on board. We have partnerships with our library, the Alzheimer's Society, the Aquatic Center. It's all depending on who wants to be involved and having that discussion.
Yep, so it's for Kim and myself, Kim and Lisa, very similar to what Alex just said. So our funding, like Michelle said, for our community recreation therapy positions is through a COVID uplift through AHS, and they are term positions till the end of September. And then Patrick with the PCN was not doing any group programming in the community when we first started our position. And when we started working with our community partners, like the PCN nurses and seniors mental health outreach and the town, we discovered there was that need. So that's kind of where that partnership, he was one of our first connections in the community, was to reach out to Patrick and see what we could arrange together. And for sure, free spaces are super important. So getting those connections established with the town and with the community facilities available. And if it's a partnership program, then they don't generally charge you for those spaces. So that was really important. And then, you know, since then we've done several other things with a community adult day support program for people living with dementia, which we've partnered with the local library for. And we're running a memory cafe right now in Drumheller once a month, which we've partnered with several different community groups, but right now it's being held for free at the Homestead Antique Museum. So it's really a collaborative effort. So it's Lisa and I putting our heads together and seeing what is available in the community, what's missing, what do people need or seniors need, and especially those living with dementia or at risk for isolation without social support. And then looking at how we can make it happen in the community and basically pulling from absolutely any direction we can find to make it work. I think the other, sorry, just one other thing. I think the other thing that's key has been some of the grants that in all the communities that we've been able to obtain, because there is no budget in AHS for, or the PCN for just those extra things like supplies. And if you do have to, you know, pay for an entertainer to come in or something like that. So being able to lobby for some grant funding has been really helpful.
And I was just going to mention too, it's really about building those partnerships and the collaboration within each of the community and looking at the community needs. So this is why it's so unique, and just even talking about the falls prevention programs that are in place, each one of the locations that were talked about, like Innisfail, Drumheller, Hannah Three Hills, and Lacombe, each of those exercise programs that are in place are all different, and they target the needs of the community. I just want to talk a little bit about space, and you know, when we're looking at space, having those partnerships with the town, like looking at the library, or I know that Ellen has used the local church and their hall that's attached to the church, just looking at space. But also just keep in mind that we, for the last 3 years, have been under COVID restrictions. So a lot of these programs were done virtually. And that was the key to that as well in the summertime, or as weather permitted. We couldn't have group programming in a facility because of the group restrictions and spacing and masking and whatnot. So a lot of these programs we did do virtually or did in open spaces. So at your local park or outside near a community facility. So just keep that in mind too when we're looking at space and funding. We had to all do this in a time where we were socially isolated from each other and not able to do groups in a facility. And we had to really think about how to deliver those services without the face-to-face connection.
Thanks, Michelle. I'm so amazed at how many programs that are out there within our communities. It's just so nice to see. I am wondering if anybody wants to unmute and ask any questions at this point. I don't see any more in the chat box, but I do want to open it up if anybody wants to comment further on anything going on in their area, or if they have more questions for any of our speakers. I'm going to open it up now for you.
This is Marita. I did get my answer earlier. Can you hear me okay?
Yes, thanks, Marita.
Yeah. The one thing is, at the beginning of your presentation, you talked about things not being fragmented and sort of things not working together. I'm actually surprised to hear this program that you have set up in Lacombe and Drumheller and everything like that. And it's wonderful. It's a really needed program right now. I can see all these exercise programs being a benefit. I'm just trying to figure out how you guys got organized and how you guys were able to have that freedom to present all the, to work on developing all these programs. It's kind of a needed thing. So I'm just wondering how we can sort of build on this, if that's a possibility.
This is Michelle. I'm the recreation therapy practice lead for Central Zone. And I'm just going to give you a little bit of background about the community recreation therapy positions that are placed in these areas. So that's Kim and Lisa and Alex in Lacombe. And Kim and Lisa are a shared 1.0 FTE in the communities of Drumheller, Hannah, and Three Hills, and Christy. Alex is in the community recreation therapist in Lacombe. So Ellen's position in Innisfail has been there for several years. I think this is the 4th year or 5th year that it has been in place. And the successes that were happening with those community collaborations and the community partners in action were really evident. And this happened prior to COVID. When COVID hit, Alberta Health Services was asked if there was anything that we could put some positions in place from COVID funding to directly impact those people living in the community with being socially isolated. So there's been a lot of research around social isolation and community collaboration and how that might look like in the communities. So these positions were funded and put in place for a year. They've now been extended for until the end of September. So a year and a half we've had. So the whole point of those positions was to really look at those people that are falling between the cracks that are not linked to home care or health services, just those people that are really in the community that were struggling and isolated and due to social isolation due to COVID and the restrictions put on by COVID. So these that's why these positions kind of came about. And that was the whole point of putting it together, so that we could reach out and look at what the needs were in the community and pull together all the community partners so that they could address what was needed and supported in each one of these communities. And each one of the communities, the programming are different and the needs of the community are different. And I know that there is other huge grants that are out there in place that you can apply for when you're looking at aging in place or dementia-friendly communities or community partnerships. And it's just really trying to get those community partners working together. And I think
Michelle?
that
Oh.
can happen in other communities.
Michelle, are you able to hear me? This is Cherith from Wetaskiwin. When these positions were set up, I don't think, or do you know, do we have a community rec therapist in Wetaskiwin?
No, so
No,
there,
okay.
these were only uplift positions, like a pilot project that we had the funding for to trial in different communities. And they were through AHS, and so they're in the communities that are listed. We have one in Vegreville as well. And that's a different unique position because it's more linked to home care. But we are really hoping that talking about this and looking at what the needs of the community are and having more people in place to be able to help support this.
Thank you, Michelle. Thank you, Darren. You had to leave. Thanks for letting us know. There is another question. I think we have a couple minutes, but Sudha in the chat has just typed in, just wondering if anyone is doing fall prevention specific exercise programming in a long-term care setup, if they could share about it. Thank you. I'll leave that open to anyone on the call, actually.
Duda, it's Alex. I can just share a little bit from when I was in the long-term care side in Lacombe, and they did some fall prevention programming there. They did a lot of like balance exercises. They had also like a walking program that was targeted towards falls, and they all had these individuals that were considered high fall risks. So they ran something, but that was a collaborative approach between like the rec therapist, the physiotherapist, and the therapy assistants. So that was more within the staff at the long-term care.
Thanks, Alex. Anybody else want to comment on that question? Okay, I also want to point out that if you do need to connect with anybody after the session, email addresses are in the chat or on the screen, so you could connect with people afterwards. I am going to just do a quick last chance to see if there's anybody else that wants to mention anything or comment before I adjourn today. So I'll just give it a minute, see if anybody has anything else.
Sorry, it's Cherith again from Wetaskiwin. One last thing I just want to say, seeing that a lot of these are virtual exercise programs, I'm assuming that anyone in any community could join into one in another community. Since we don't have them in Wetaskiwin, if we had a person who was capable online and wanted to join in with one in Lacombe, that would be fine, right?
Yes, that is correct, as long as they contact Christy or I for registration, just so that we can go through some safety precautions and risks. But yes, that's correct. Same with Innisfail and Let's Connect with what Michelle said.
Great, thank you.
I will say though that technically PCN programs are only supposed to be attended by people whose physicians are associated with PCN. So that's the technicality, but like Alex said earlier, we try to work with other people and try not to turn someone down, but I'd recommend trying to look for your local PCN first and see if there's a program associated with them. And then if not, kind of branch out and look elsewhere. So for example, there's a question about Edmonton. If you have people in Edmonton, try and look at an Edmonton-based PCN or Alberta Health Services in Edmonton first. And then if there's nothing there, try to look elsewhere.
Thanks, Brad. Good point. Okay, and there is Cindy has just reminded us from tech support of the survey, so please feel free, and we encourage you to fill out the survey, and this will help us plan further events. Okay, on behalf of the Central Alberta Falls Prevention Group within CORE, I thank you all for attending today, and we look forward to touching base with you later. And I encourage you to join our group within CORE as well. And thank you, Michelle, for adding the Edmonton PCN link there as well. Okay,